Hello everyone and welcome to ADO's May webinar. And since May is National Stroke Awareness Month, we'll be taking an in-depth look at the symptoms, causes and treatments for strokes. Today's speaker, as always, is Clinical Assistant Professor from Georgetown University and ADO's Medical Director, Dr. Howard Zahalsky. Welcome, Dr. Zahalsky, and thank you for joining us today.
Thank you again, Tom. So today we're going to be talking about stroke awareness, what causes strokes, and what you can do about a stroke. So the first thing we have to do is be able to identify a stroke. So here is a picture of someone who has had a stroke that's affecting the right side of their face. For reference point, when we're looking at pictures of CAT scans and of patients, obviously the right side of this patient's body is the left side of the picture. So I'm going to frequently be referring to the right side of the picture as the left and the left side of a picture as the right, because that's how doctors usually refer to these things as. When you have a stroke, strokes usually affect one side of the body, like you see in this. That's because one side of the body is controlled by one side of the brain and the other side of the body is controlled by the other side of the brain. And you may have heard in the past, which is true, that the left side of the brain controls the right side of the body and the right side of the brain controls the left side of the body. So when you have a stroke, which is usually in a fixed area, whatever area it's in, the other side of the body will typically be affected. And one of the more common symptoms of a stroke is paralysis, where you can't move your arm, your leg, or in this case, the face. This is someone who's trying to smile and is able to get their mouth to smile and open up on their left side, but their right side is staying flat. You can also see they've lost what's called the nasolabial fold. That's your smile mark that goes from your nose to the corner of your mouth. Looks kind of like they got Botoxed on the right side of their face, where all of the natural lines that you have kind of flattened out because all of the muscles of your face have loosened up. Now, there are certain parts, for instance, for the right side of the face, the right arm, that are in very clear areas. As I said, the right side of this person's body will be affected by the left side of their brain. But there are some more interesting areas of the brain that can be affected by stroke that you may not have thought of as discrete areas that can be affected. One of the main ones is the language centers. Most people have the language center on the left side of their brain, very close to where the right arm and right face are controlled. So a lot of times if you have a stroke that affects the right side of your body, you will also have trouble speaking. We call this aphasia, having trouble getting any words out and having trouble making your words make sense. If you take nothing from this webinar, it should be that when you have a stroke, time is brain. Everyone thinks, oh, I'm having chest pain, I better rush to the hospital. But a lot of people get symptoms of a stroke, a paralyzed right side of your face or numbness down one side of your body, and they think, oh, well, let me just go to sleep on this. I'm sure it'll be gone when I wake up, or let me just shake it out. I'm sure it will be okay. If you think there's any chance you're having a stroke, get to the hospital immediately. We have treatments for stroke, but they only work if administered, generally speaking, in the first 3 hours after symptoms have started. So if you have any symptoms of a stroke, get to the hospital immediately. Now, let's start with what causes a stroke. So here is a very complicated picture that I had to memorize at some point of all of the blood vessels of the brain. Strokes are caused by blocked blood vessels. Now you see there's a lot of blood vessels here that can be blocked, and there's two ways to block a blood vessel. One is with a clot that flies somewhere else and lodges in a blood vessel. We call that an embolic stroke. Another is that the blood vessel itself just gets scar tissue or cholesterol buildup and blockages that grow over time, and we call those thrombotic strokes. Now, when we're looking at strokes like the one from the woman in the last picture, the most common cause of a stroke is a blockage or clot in what's called the middle cerebral artery. Now, all of the labeling here is on the left side of the slide, which again is blood vessels that are on the right side of the brain. We're looking here at your brain from the bottom. These are all blood vessels. Most of the blood vessels run along the bottom side of the brain. To identify the middle cerebral artery, it's the third named artery down on the left. And you can see that the line from it is pointing over to a fairly good-sized artery towards the right upper part of this person's brain. When you have a stroke on that artery, it's the type of stroke that typically leaves one side of your whole body paralyzed, and if it's on the left side, oftentimes unable to speak. It's the most classic stroke. One thing I want you to note from this picture is that it is almost impossible to knock out the whole brain at one time in a stroke. Why is that? Well, the brain has a lot of circulation and a lot of redundant circulation. I want to draw your attention to the center of the picture, where it looks like the blood is actually going around and around in a circle. It's kind of where that middle cerebral artery and anterior communicating artery and anterior cerebral artery, they all meet in what appears to be a circle, and it is in fact a circle. That circle is called the loop of Henle. In the loop of Henle, all the blood that goes to the brain goes around in this circle and then gets distributed to all of the branching arteries that go to the different parts of the brain. Because of this, you can't have a stroke that affects all the different parts of the brain at the same time, because there's 3 separate arteries that give blood into that circle. And so even if you block off one of those arteries completely, you're still going to get blood into the circle, and it's still going to distribute throughout the brain. You can only usually block one branching artery, whether it be the middle cerebral artery or the anterior communicating artery, at a time there. Now, one of the arteries that is actually bringing blood, it's not really clear from this picture, but the basilar artery, that's the 4th one from the bottom, and it's the biggest blood vessel that seems to come off the bottom of that circle in the middle, the bottom of the loop of Henle. It appears like that's another branch off of the loop of Henle. Actually, that's a blood vessel that's bringing blood to the circle, to the loop of Henle from your heart, essentially. And that is the blood vessel that is most responsible for giving blood to the back of the brain. If you block that artery, rather than the middle cerebral artery, for instance, you're not going to get weakness or numbness on one side of your body. What you are typically going to get is a stroke in the back of your brain. Why is that significant? Well, that's where 2 things are stored. Number 1, that's where your vision is stored, and number 2, that's where your balance is stored. So a hallmark of strokes in the back of the brain is someone who all of a sudden has severe balance problems, and that can be another alert that you've had a stroke. So you've had one of those typical strokes of that middle cerebral artery, that big blood vessel that comes off of the loop of Henle. What is going to be affected? Now, if you block the whole middle cerebral artery, all of your musculature on one side, the right side, for instance, the right side of your face, your right arm, your right leg could all be affected. But sometimes you only have a blockage of one of the smaller branches that comes off of that middle cerebral artery, just one little branching artery. And it depends which part of your brain that it goes to as to what gets affected. You can see in this picture that a person is essentially painted onto their brain in different places. We call this a homunculus. It's basically a miniature person on the brain, and you can see towards what is actually the middle of the brain. Imagine that this is the left side of someone's brain. So since, as I said, when we look at it, what's on the right side of the screen is the left side of their brain. That would make that foot that you see drawn there right at the middle. Imagine that there's another mirror image of this to the person's right, or rather the left side of the screen that has been cut away. So if you have a stroke that affects the middle of the brain coming off of the middle cerebral artery, you're going to affect the foot, the leg, the hip. On the other hand, if you have a stroke that affects only the branches of the middle cerebral artery that go to the outside of the brain, it's going to affect your face or your hand or your arm. if you have a stroke that affects one whole side, it's usually considered, obviously, a much bigger deal. It's much more likely to be a blockage of the whole middle cerebral artery, which can be catastrophic. But there's one good piece of good news. All of these parts of the homunculus come together at one little area before they go out to the rest of your body. That little area is called the basal ganglia. Sometimes you could just have a tiny little stroke of the basal ganglia and not a whole big stroke of the whole middle cerebral artery. So there's a lot of times that people will come into the emergency room, their whole left face, arm, leg is paralyzed. But all of the symptoms go away over the course of a couple of days. That's because they probably just had a teeny tiny stroke in the basal ganglia and the body was able to reroute around it. How can you tell the difference? Well, if the stroke affects your right side, so the left side of your brain, and affects that whole area but doesn't affect your talking, that means it's probably a basal ganglia stroke because it only is affecting the musculature and it's not affecting the language centers. And if you knocked out the whole middle cerebral artery on that side, it would have affected the language centers as well. On the other hand, if it's affecting the left side of the body, so the right side of the brain, you don't have the language centers to go on, so you have to base it on CAT scans that we'll get to in a little while, MRIs, and just the clinical picture, what seems to happen. A stroke in the back of your brain can result in vertigo. We already talked about how a stroke of that basilar artery in the back of your brain that is bringing blood up to the brain from behind supplies a lot of the blood for the back of the brain. If you have a stroke in the back of your brain, your balance can be affected, and one thing that you can get is some severe vertigo. So this is another warning sign that you have to be alert for strokes. Now, a lot of people get vertigo. If we rushed everyone to the hospital every time they got some vertigo looking for a stroke, we would overload our emergency room. So not all vertigo is a stroke. But if you started getting vertigo in your 20s and 30s and you still get vertigo every couple of years over the course of your entire life, you probably don't have to worry if you get a little bit of vertigo here and there. That vertigo is called BPPV, or benign positional vertigo. On the other hand, if you've never had vertigo in your whole life and you're 75 years old and all of a sudden you're beset upon by vertigo so severe that you're not able to walk, and oftentimes with a little bit of word finding difficulty as well, that should alert you that you could be having a stroke, and you should make sure to get to the emergency room quickly within that 3-hour window. So we talked that there are two types of main strokes. The kind where the clot flies to a blood vessel and blocks it, and we call that an embolic stroke. And another one where the blood vessel slowly blocks over time, and we call that a thrombotic stroke. There are different ways that you get those two different types of stroke. Obviously, if you have an embolic stroke, you have to get a clot from somewhere. And where are you going to get a clot? Well, you've probably all heard of deep venous thrombosis, or DVTs, which are blood clots in the legs. Rest assured, those almost never cause strokes. The type of clots that cause strokes the most often are clots that actually form in your heart. And the most common reason for a clot to form in your heart are funny heart rhythms, particularly one called atrial fibrillation. It's the most common cause of heart rhythm disturbances causing strokes. If you have atrial fibrillation, one of the small chambers of your heart doesn't squeeze right and causes blood to pool in your heart. This pooled blood can clot, and it tends to fly all over the place. You can get little lines in your nails where you're actually getting microscopic little clots called splinter hemorrhages in your nails. But in the most severe cases, it can cause clots to fly to your brain and cause strokes. People with atrial fibrillation need strong blood thinners oftentimes for their entire life, even if their atrial fibrillation isn't always there, in order to prevent strokes. Because even when you're not actively having atrial fibrillation, the small part of your heart that is affected by the atrial fibrillation still doesn't squeeze quite right and still is at higher risk of forming clots. Another cause of strokes is chronic high blood pressure. High blood pressure, think of it like blowing up a balloon. Every time you blow up a balloon, if you blow it up just a little bit, it's okay. But if you blow it up too much, it rips at the inside of the balloon. Now, a balloon itself is going to pop. Fortunately, most of the time, your blood vessels don't pop. They have enough resilience to handle most blood pressures, even blood pressures of over 200 for the systolic or top number. But what you are doing is stretching the internal wall of the blood vessel enough that it starts to get ripped and damaged. Your body heals that damage. How does it heal it? It heals it with scar tissue. We call that scar tissue plaque. That scar tissue can build up over time, and millions and millions of heartbeats causing millions and millions of stretch injuries and scar tissue can over time cause blockages to build up in the blood vessel that can cause thrombotic strokes or strokes that are caused by damage to the blood vessels leading to blockages in the blood vessels. It's even worse if you have high cholesterol. With high cholesterol, you're much more likely to get these plaques that are building up. When you do damage the internal wall of a blood vessel, the plaques, which are formed mainly for cholesterol, grow really big. Now, I'm sure you've probably all seen someone with really ugly scars called keloids. If they get even a little cut, they get these lumped up scars that sometimes they have to go to the dermatologist to have treated. The inside of your blood vessels can be like that if you have high cholesterol. A little bit of damage can lead to a big lipid deposit of plaque like you see in the right side of this slide. That even a little bit of damage can lead to a blockage that can block a blood vessel 20, 30, 40, 50, up to 90 to 100%, which obviously over time is going to block the blood vessel and can lead to a thrombotic stroke. Obviously, we have to treat each of these causes of clotting and blockage different. If your problem is mostly blood pressure, we have to lower your blood pressure. If your problem is mostly overgrowth of cholesterol plaques because your cholesterol is so high, we have to treat that. If your problem is atrial fibrillation, we have to control the blood clots and the atrial fibrillation in your heart. We have to tailor our treatment for which type of risk you might be at. So you come to the emergency room with numbness on one side of your body, weakness on one side of your body, maybe dizziness. What's the doctor going to do? Well, the first thing they have to do before you get treatment is a CAT scan. And there's a lot of reasons why you have to always do a CAT scan first. But this is one of the most obvious strokes that you're going to see. On the left side of this person's brain, which again is the right side of the picture, you see a big black area. That's not normal. The left side of the picture, which is the right side of their brain, is a somewhat normal looking brain. It's actually not quite normal. It's being a little squished because the black area on the other side is actually pushing part of the brain over to the patient's right. This is a big, big, ugly middle cerebral artery stroke. This person almost certainly has language problems, and the whole right side of their body is likely paralyzed by this stroke. Strokes can be much more subtle. They can be little dots that look like a tiny little hole or a pencil eraser. On the right side of this person's brain, you're saying, well, but I see a lot of things that look just like that black area. I see lots of black areas. Well, there are certain places where there's supposed to be black areas in your brain, and take my word for it, this person has their black areas in appropriate areas. It's when those black areas develop in areas that are not supposed to have them that you know that you have a stroke. So how do we treat a stroke? Well, the best way to treat a stroke is prevention. And we talked about some of the ways: controlling blood pressure, controlling cholesterol, controlling atrial fibrillation. Even if you have had a stroke, if you do not have atrial fibrillation, that's a whole different kettle of fish. If you're suspected of having a thrombotic stroke, the best treatment is aspirin. To be honest, it doesn't matter how big the stroke is. The best treatment is aspirin. Some of the stronger blood thinners work by changing the way blood clots inside of your body. Those are the stronger blood thinners that we tend to use for clots around the body. However, strokes, which are caused by progressive tightening of arteries, they tend to be made worse by something called platelets. Not going to give you a whole hematology lecture today. Maybe we'll do that as a different webinar. But platelets, which are these little sticky things that float around in your blood, are not affected by most of the strong blood thinners, but aspirin does affect it. This is why aspirin tends to lead to a lot of bruising, because it deactivates those sticky little platelets and is very good at treatment, especially of small to medium strokes, once you get beyond that 3-hour window. If you are still within the 3-hour window, the treatment is usually not aspirin. If you get to the hospital with a good-sized stroke within 3 hours, we do have some very, very potent clot-busting medications that are frequently given. Now, these obviously can only be given in the hospital, and even once you've had those, you usually get started on the aspirin as well. These clot-busting medications, although very effective at reversing some strokes, carry a 3 to 6% chance of killing you by causing massive bleeding in your brain and otherwise. So you have to be having a really large stroke before we're going to be eager to give you those medications, given how high the risk of death. But if we're talking a risk of a 3 to 6% chance risk of death versus you're going to be in a wheelchair with one side paralyzed for the rest of your life, if we don't try it, most people are willing to take that risk. But for strokes that aren't particularly large, or for stroke prevention from thrombotic strokes, aspirin is really the first treatment of choice. All right, I did this just to get a rise out of everybody. Stronger blood thinners may be needed in certain individuals. Who are these going to be needed in? These are particularly necessary for people with those embolic strokes, particularly the people with atrial fibrillation. Now, I put rat poison here. Coumadin, which has for many decades been used as the main blood thinner for atrial fibrillation, is actually the same ingredient as rat poison. In rats, it kills them by causing uncontrollable bleeding in the rat, which is what kills the rat. In humans, we're a little bit more careful, and when we put you on Coumadin, we measure your blood frequently, oftentimes monthly, to make sure you're on just the right dose to keep your blood thin enough so that you don't get any clots in your heart, but thick enough so that you don't get uncontrolled bleeding. But it has, over the years, been a dangerous medicine because it can be very affected by diet, by what other medicines you're on, by what time you take the medication. So some people do get bleeding, and some people end up getting clots anyway because we don't get the dose quite right. Because of that, there have been several new medicines that work similarly to Coumadin that have come out, with names like Xarelto and Pradaxa, that do the same thing essentially as Coumadin, but without as many interactions with food, without as many interactions with other medication, and without the need for as close monitoring of blood tests. So a lot of patients are actually preferring those medicines these days. The big downside being, number one, for right now, they're much more expensive than Coumadin, which has been around for, again, decades. And the other thing is we can't reverse them. So with Coumadin, if you get too much Coumadin and you start to bleed, we have a medicine that we can give you that essentially instantaneously reverses the Coumadin. We don't have that with Xarelto and Pradaxa. So if you do have bleeding complications, we have to wait for the medicine to wear off, and that can be somewhat dangerous. So to some degree, we're trading convenience and accuracy for risk of side effects. So again, the take-home message, though, is time is brain. If you think you're having a stroke with any of the symptoms we talked about, language finding difficulties, weakness or numbness in one arm, one leg, or one side of your body, word finding difficulty, and vertigo, you want to get to the hospital quickly to, if necessary, get the clot busting medication, to get a CAT scan to make sure that you are or are not having a stroke and get the appropriate treatment. You also want to make sure you're monitoring all of your risk factors, atrial fibrillation, getting your heart checked, watching your blood pressure, watching your cholesterol, because strokes can be devastating and your brain does not grow back. Most strokes do not get much better over time. So the getting to medical attention as soon as possible if you think you're having a stroke can be the difference between living the rest of your life as a well-functioning individual or as someone who ends up needing to live in a nursing home being cared for other people. How can Activ Doctors Online help you to protect yourself against strokes and to treat strokes once if you are unfortunately unlucky enough to get one? Our first solution is our personal health records. This allows you to keep track of all of your medical records wherever you are. Whether you go to multiple doctors or multiple countries, all of your records are always with you. You can track your blood pressures. You can track your cholesterol. If you're on Coumadin for atrial fibrillation, you can track your doses of medication and how thick or thin your blood is. This makes sure there's no gaps in your care to make sure you're keeping all of your risk factors well modified. Second, with our second medical opinions, if you wish, we can put you in touch with some of the top medical experts from around the country and around the world. If you're unlucky enough to have a stroke and you want to know what the best treatment for you is, by using one of our second medical opinions, we can get you some evaluations through your online chart with one of our top neurologists around the country, oftentimes within 48 hours, to make sure that you're comfortable that you're getting the best treatment. And finally, with our e-consultations, if your doctor is a participating doctor with Activ Doctors Online, you can have video conferencing with your doctor. Now, I don't recommend that you use this for if you think you're having a stroke. If you think you're having a stroke, get to the emergency room. But if you think it would be wise to have a conversation with your doctor about modifying your stroke risk factors, this might be a very valuable solution for you. So with that, I'm going to pass it back over to Tom, who's going to tell you a little bit more about Activ Doctors and how these solutions can help you and what Activ Doctors' vision of keeping you healthy is.
Well, thank you, Dr. Zahalsky, for another superb presentation. Here at Activ Doctors, our vision is to reinvent healthcare by providing user-friendly mobile health solutions that allow people all over the world to live safer, healthier, and more productive lives. We strive to educate, engage, and empower our members to take control of their health destiny to save time, money, and even lives. We hope you enjoyed today's presentation, and we invite you to start your free 30-day trial over at activdoctorsonline.com and by clicking Get Started. And for more information, to schedule a demo, or if you have any questions about our service, please feel free to contact Activ Doctors Online using the information on screen. We're also available via all the major social media channels. Thank you for watching, and we look forward to seeing you next month for another informative health webinar.